Ladies and gentlemen, welcome to my presentation. My presentation is related to life satisfaction and depression of women with a history of child sexual abuse. I'm Dr. Anna Ng from Caritas Institute of Higher Education, Hong Kong. This research project is supported by the grants awarded by the Research Grant Council of Hong Kong. Child sexual abuse can be expressed in other terms, such as child sexual assault, child sexual victimization, child sexual exploitation. And child sexual abuse affects the mental well-being of victims, according to the literature, and it can also produce psychosexual impairment. The American Academy of Pediatrics define child sexual abuse as occurs when a child engaged in sexual activities that child cannot comprehend, they are mentally unprepared, and cannot give consent, violates the law or social taboos of society. In Hong Kong, the definition of child sexual abuse by Social Welfare Department is forcing to take part in any acts of sexual activity the child does not consent to or fully understand due to mental immaturity. And the long-term effect of child sexual abuse, which is associated with psychological symptoms such as social anxiety, depression, post-traumatic stress disorder, and dissociation, were most common according to the literature. The focus of the current study is on psychosexual impact of child sexual abuse on life satisfaction and depression, as well as sexual self-concept. And life satisfaction and depression commonly referred to as positive and negative well-being. The former is more cognitive in nature, whereas the latter more affective. Sexual self-concept is an evaluation of one's own sexual feelings, thinking, one's actions, and how one perceives oneself as a person of sexual being. It reflects a person's sexual health, component of holistic health that's associated with quality of life. The objective of this study is to study the impact of child sexual abuse on life satisfaction and depression of child sexual abuse survivors, and to examine the impact, whether there is any impact is affected affected by the sexual self-concept. So we'll try to see whether sexual self-concept is actually playing the mediating role in affecting the person's psychological well-being. And data collection, we collect data on child sexual abuse survivors through clinical settings referred by a social agency and a center. And data on non-child sexual abuse women will recruit through convenient sampling from the community. There are 83 women collected with a history of child sexual abuse, and 89 women respond to our research. They are without child sexual abuse. And there's no significant difference in the demographic characteristics between the two groups of participants. The measures of psychological health, we adopt two scales. One on life satisfaction, and the second is depression. And for life satisfaction, there are some items such as conditions of my life are excellent, and I'm satisfied with my life. And depression scale with the items such as I felt depressed, I had trouble keeping my mind on what I was doing. And measure of sexual self-concept. Based on the literature review on sexual behavior of child sexual abuse survivors, social workers' clinical observation of child sexual abuse survivors, and also based on my own research on female sexuality and to the in-depth interviews with the child sexual abuse survivors, we have chosen 6 scales to be conducted, used, adopted in the current research. The 6 scales were extracted from the SNEL's multi-dimensional sexual self-concept questionnaire. And we group them into positive sexual self-concept and negative sexual self-concept. The positive part, we include sexual self-esteem, sexual self-efficacy, and sexual satisfaction. And the negative part includes sexual anxiety, sexual depression, and sexual fear. And these are some examples of sexual self-concept, include sexual self-esteem. We have some items such as I'm proud of the way I deal with sexual desires. And sexual self-efficacy, we have questions like I have the ability to take care of my sexual needs. And for sexual satisfaction, we have the items such as I'm satisfied with my status of sexual fulfillment. And sexual anxiety, we include I'm worried about my sexual life. And sexual depression, we have a question like I feel unhappy about my sexual experience. And about sexual fear, we have the question like I have fear of sexual relationship. All these measures adopted in this current survey or research are cross-validated. So we have life satisfaction, depression, and sexual self-concept scales. So all these 3 scales are validated. For life satisfaction and depression, this is the finding. We find that for women with child sexual abuse history, they are significantly lower in life satisfaction, as well as demonstrates a greater depression. And can say that they are at a greater risk of the development of psychiatric symptoms. And then see, for the impact of child sexual abuse on sexual self-concept, as you can see from the table here, we find that child sexual abuse survivors, they are having a lower score in positive sexual self-concept is lower. For instance, for these 3 items, these are the positive sexual self-concept. The score in general for child sexual abuse history, women with this CSA history, they score lower than the non-child sexual abuse respondents. And for the negative sexual self-concept, they score higher compared with women with no child sexual abuse history. So you can see child sexual abuse survivors had a greater impact on negative sexual self-concept. Here, the impact is greater for the negative sexual self-concept. If for women, they have this child sexual abuse history. And what about the relationship of sexual self-concept with life satisfaction and depression? As you can see from the table, we find that the association of sexual self-concept with life satisfaction and depression are in our expected direction. And comparing the significance of effect, we find that sexual self-concept are more significantly related to depression than to life satisfaction. As you can see here, the significance level is higher. So more items are with significant findings here. And what about the mediating effect of sexual self-concept? From this, our finding of this ANOVA and COVA finding, we can see when we control for the positive sexual self-concept, the F value decreased from 18 to 10, and we control for negative sexual self-concept, the F value drops to 8.9. So that means we can see that negative sexual self-concept exert greater eliminating effect. And sexual self-concept mediates the impact of child sexual abuse on life satisfaction as well as depression. And also we can see that life satisfaction remained significant after the positive sexual self-concept and negative sexual self-concept was controlled for. And so CSA, child sexual abuse history, exerts more of direct effect on life satisfaction. And other factors may be associated with life satisfaction of the survivors as well. So you can see, according to our research, we find that survivors with child sexual abuse show that life satisfaction and depression, life dissatisfaction, so and as well as depression, and then the survivors of their sexual self-concept was harmfully affected. And also, we also find that sexual self-concept plays the mediating role. So it mediates the impact of child sexual abuse on depression, but less so on life satisfaction. According to the literature, we find that the effect of child sexual abuse is pervasive. For life satisfaction, they find that their life dissatisfaction may include lower job success and more negative life events, health problems, shorter lifespan, less motivation for successful outcomes, high risk of mortality, poor mental health, poor health-related quality of life, and psychiatric morbidity. And for depression, we find that cognitive impairment, poor memory, poor health, and bodily pain, impaired affiliation, and impaired social communication and social perception. And impaired social perception as well as reduced or poor social networks, and there's also concentration problems and impaired psychosocial functioning, as well as lower quality of life. The second implication is on the intervention. When we are helping these survivors to enhance their better status of psychological well-being, for instance, when we want to promote their life satisfaction as well as reduce their depression, we find that the intervention aim should focus more on the negative sexual self-concept than the positive sexual self-concept. And of course, we should also base on the intervention on focus on the intervention on the adjustment of their sexual self-concept instead of just on other aspects of their experience. Because for this research, you find that the sexual self-concept is actually playing this mediating role. So that means the child sexual abuse history is having effect on their psychological well-being through the sexual self-concept. So this is our suggestion. And here comes our references. Thank you.